Okay, this video is about oral surgery or dental implant surgery. It's not quite as simple and straightforward as it might seem. In fact, it usually involves a multi-step process, only the last of which is actually inserting a false tooth. But before an oral surgeon can do any of that, he or she must do a considerable amount of analytical work and then lay the groundwork for this false tooth implant. What does the groundwork consist of? Quite simply, laying groundwork for a false tooth involves simulating a root. This can be done in a number of different ways, but it usually involves making an incision of part of the gums, opening it up, and then drilling down into the bone. For those of you who are gagging or cringing at this point, don't worry. If you opt for dental implant surgery, your oral surgeon will find ways to make it bearable, even if the very thought of it is hideous. Once your oral surgeon has drilled down into the bone, he or she will implant a false root, which is almost always made out of metal. He or she will then close it and stitch up the incision. Now that the first part of the dental implant surgery is complete, you will usually have to wait several months for the incision to heal and for the implant to ossify, or have bone grow around it and seal it into place. The next step in dental implant surgery involves paying careful attention to that false root. You will want to eat soft foods whenever possible, and you will want to avoid chewing with that side of your mouth. In the first few days, that might be quite easy, as it will be painful if you attempt to eat with that side of your mouth anyways. But in order to ensure a successful dental implant surgery, you will have to continue avoiding that implant so that it can heal faster and more completely. Once your gum is healed and that implant is locked into place by bone, you will then return to complete the dental implant surgery. The last part, of course, is putting in the actual false tooth. This usually involves attaching your tooth to the false root and then netting it into place with titanium. The end result of any successful surgery is a new set of teeth that are firmly in place and attached to a strong, artificial, yet ossified bone implant.